Biomechanics of hip joint. This is a very important topic for postgraduates, which can be often very confusing. So let us see the forces acting on the hip joint in a double leg stance phase. In a double leg stance phase, the weight of the body acting through the center of gravity is equally supported by both the hip joints. For the purpose of illustration, let us assume the body weight to be 60 kg and the limb weight to be 1/6 of the body weight, that is 10 kg, and g to be 10 meter per second square, which is the acceleration due to gravity. Now, the weight that has to be supported is the body weight minus 2 times the limb weight, and the limbs are already on the ground in the double leg stance phase. So the weight that has to be supported comes to 40 kg. Now force exerted due to this weight is 40 into 10 is 400 Newton. Now this is equally shared by both the hip joints, so the joint reaction force in each hip joint comes to around 200 Newton. Now let us see what are the forces acting on the hip in a single leg stance phase. In a single leg stance, the force of the body generates a turning movement across the hip joint, converting this into a class 1 lever, and this force has to be balanced by another force on the opposite side, which is known as the hip abduction force. Now in a class 1 lever, we have two lever arms. The fulcrum is there in the center, and this is the body lever arm, that is the distance of the force of the body weight from the fulcrum, and this is the abductor lever arm, or the distance of the fulcrum from the abductor force. Now in a class 1 lever, for it to maintain equilibrium, force into distance of the lever arm should be equal on both sides. So to calculate for hip abductor force, HAF into d by 2 should be equal to FB into d. Solving for it, HAF or hip abductor force comes to be around 1000 Newton. Now we calculate the joint reaction force. Joint reaction force is the hip abductor force plus force of the body weight, and it comes to approximately 1500 Newton. Now we have to remember that this is an approximate calculation because exact calculation varies slightly. For that we have to resolve this HAF into vertical and horizontal components, and then add the vertical component of HAF with this force of body weight, and then use Pythagoras theorem to add this horizontal component of HAF with the added vertical component to get the exact GRF. However, the value that we get is close to this value, and for the purpose of simplification we have used this simple calculation. So using this calculation, we get that in a single leg stance phase, the joint reaction force is around 2.5 times the body weight, assuming the body lever arm is twice the abductor lever arm. Now let us see what happens in a Trendelenburg gait. In a Trendelenburg gait, the body sways to the side of the affected hip. Now it decreases the body lever arm. So now the body lever arm decreases and the abductor lever arm has become 2 by 3 times of the body lever arm compared to the half times the body lever arm in the previous scenario. Now if we solve for the hip abductor force using the same formula, we get a hip abductor force of 750 Newtons and a joint reaction force of 1250 Newtons compared to a 1500 Newton in the previous case. So we can see that Trendelenburg gait is a compensatory mechanism of the body to decrease the joint reaction force. Now let us see what happens when we put a cane in the opposite hand. Now this cane in the opposite hand generates a cane force which acts in the opposite direction. So this hip abductor force and the cane force are actually acting in the same direction, and this FB or force of the body weight is acting in the opposite direction. If we look at the lever arm of this cane force, it is quite large, and let us assume it to be 3 times the body lever arm for the sake of calculation. So now for both the moments to be equal, the hip abductor force into half times D plus the cane force into 3 times the D should be equal to 500 Newton into D. If we assume a cane force of 100 Newton, then if we solve for this equation, we get a hip abductor force of 400 Newton and a joint reaction force of 900 Newton, which is greatly reduced from the first scenario of 1500 Newton. So we can see that putting a cane in the opposite hand decreases the joint reaction force. Another scenario is if we put a load in the same hand. Again, if we see, putting a load in the same hand puts a moment or a turning moment opposite to the force of the body with a relatively larger moment arm, decreasing the hip abduction force. Now let us look into the strategies to decrease the joint reaction force. Joint reaction force can be decreased by decreasing the force due to the body weight or decreasing the hip abductor force. Weight reduction decreases the force due to body weight and decreases the joint reaction force. Cane in opposite hand and load on the same hand, as we have seen earlier, decreases the joint reaction force. A medialization of the cup in total hip arthroplasty decreases body lever arm and increases abductor lever arm, decreasing the hip abductor force. Decreasing the neck shaft angle again increases the abductor lever arm to decrease the hip abductor force. Trochanteric advancement to a more lateral and distal position again increases the abductor lever arm to decrease the hip abductor force or the joint reaction force. So friends, this was a discussion on the biomechanics of the hip joint, which is a very important topic for postgraduates. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also comment in comment section regarding the topics you will like to be covered in the future videos. Thank you.